Hi everyone, and welcome to another episode of Health Avenue podcast powered by Al-Ahli Hospital. I'm your host Fadi, and today's topic is about strength, movement, and the things that keep us going on every day. We are shining a spotlight on Al-Ahli Hospital Orthopedic Center, one of the leading centers of excellence in the state of Qatar. And I'm honored today to take us through this journey to welcome Dr. Stanley Jones, consultant orthopedic surgeon, specialized in foot and ankle surgery and also in pediatric orthopedics. Welcome, Dr. Stanley.
Thank you very much, Fadi. Thanks for this wonderful introduction.
Thank you, Doctor. Dr. Stanley, it's an honor to have you today with us in our podcast. And Al-Ahli Hospital has a legacy of 21 years, and we are still counting. Could you please share with our listeners and audience what makes Al-Ahli Hospital stand out from others in the region?
Well, what makes us stand out? A number of factors. First and foremost is we've been around for a number of years.
Yeah.
And we've stood the test of time. Patients who came to us many years ago, many of them still come to us. And that itself is a testament that they believe in the service they are receiving, they trust the doctors who they see, and that's why they keep coming back. The other factor is that we offer a comprehensive service. So not only from the clinician side, orthopedic surgeons and the team we have built on consultants and specialists, but also we have a team of nurses, physiotherapists, and allied health professionals who support the team. So as we all know, we cannot run a service just on our own. We need that full support to give the patient the comprehensive care that they require. So that is what has made us stood out over time.
Dr. Stanley, you're specialized in foot and ankle surgeries. Many people, they underestimate the vital role of these parts in the body. Could you share with us why this area is really important?
Well, the foot and ankle is a very important part of the human body. As we all know, without a foot and ankle, we cannot move from A to B. We have to move around in our daily lives for work, for leisure, for pleasure, for anything we want to do, for shopping, anything we want to do, we have to. And if you have a foot or an ankle that doesn't move, is painful, cannot wear shoes, then we're going to struggle to do these activities. And I can tell you, small problems with the foot and ankle can cause a lot of
serious problems.
Oh, yes. You see patients who come to us and say, I didn't realize this problem is why my foot and ankle is so important to me. This small problem I have is giving me so much discomfort and I can't get around. So that is one of the most important things for us. And it also helps us retain our balance. Mm-hmm. So if we don't walk properly because we have an issue with our foot and ankle, and that is to say, if we start limping, the next thing we develop problems high up the body. So we develop back pain, we develop hip pain, and then it's a cycle that opens up to other issues.
And it will affect the spine as well.
Oh, absolutely. So it's very crucial for us to keep our feet and ankles in good shape all the time.
And healthy as well.
Absolutely. With respect to the foot and ankle, we do quite a few operations. Depending on the needs of the patient. So we cover all aspects of surgery to the foot and ankle, from the front of the foot to the ankle region. So people with bunions, people with toe deformities, people with arthritis affecting the joints of the front of the foot, people with fractures, those with ligament problems around the ankle, those with problems of arthritis of the ankle joint, Achilles tendon problems, which is quite common, plantar fascia problems, what else? And many other fractures around the foot and ankle. So even though it's a small part of the human body, there are a lot of things that can go wrong and a lot of operations that can be carried out around the foot and ankle. And we do all of these operations.
All of these surgeries. And we also provide conventional treatments for such cases as well. Right?
Conventional treatments such as physiotherapy, something called shockwave therapy, injections if required, not for every patient, but if required. And we teach the patients exercises that they can do themselves also, and advise also on appropriate footwear. Those who need to go to get some insoles, things you put in the shoe, we advise them where to go, where to get the insoles. Even in terms of normal, what type of shoes to wear, we tend to recommend and say, go buy this more comfortable shoes, and also do some sports.
It's an holistic approach, right?
Absolutely. Yeah. You can't just think you will do one type of treatment, and the key is to get the patient better from the condition. So it's not just about treating the pain, because if you treat the pain and you don't treat the problem, the pain will only come back. So it's all about addressing the pain, but also addressing the problem that is causing the pain. And we tend to advise patients what to do. We don't just say, go and have an operation. We'll always start off simple and progress along the way. And if the patient gets better by a simple approach without the need for surgery, very good. We have avoided surgery. If simple measures fail to relieve the symptoms and the problem, we go to the next step. Yes, correct.
Dr. Stanley, sports medicine has become such an important part in modern healthcare. Many athletes, they seek the help and the advice of specialists like you to keep them moving all the time and to keep them healthy.
Yes.
What does Al-Ahli Hospital Orthopedic Center provides the athletes and the people who are seeking the service with options?
Well, we have many options for most of these sports people who have problems related to sports. So in the first place, we would consult with them, listen to their problems, and try to work out by taking a good history, examine them, and if need be, investigate to find out what actually the problem is that's causing their issues or stopping them from doing their sports. Yeah. So that is the first line of treatment. And once we come to a diagnosis, it's not just about painkillers. Painkillers form part of the treatment to make them better, but it is also, we advise on maybe offloading the area, wearing some special shoes or boots, physiotherapy, chiropractor, injections. So all the various holistic approach we've talked about already, all the various options to help them recover from their injury or whatever their problem is, so they can get back to the sports that they were undertaking.
And what helped us to diagnose it in a right way and to provide the holistic care is the state-of-art radiology department that we have.
Yes, we have a very good, new CT scanners and MRI scans, but also a good X-ray service. And it is crucial as a backup service to help you come to a diagnosis. So definitely, if you take a history, examine, but you cannot be shown the diagnosis, then that is when you need all these imaging modalities to help you come to a clear diagnosis. And I can tell you, if you have a bad ultrasound or bad MRI, you may miss the diagnosis.
Definitely. Well said, Doctor.
These are very important in coming to the good service we provide in terms of patients coming. Patients always come back and say, I've seen many doctors, but, you are the first one who has listened carefully to me or my team. You are the first ones who examine me. Most doctors just don't examine. And your service is punctual. When they come, they are seen within a very short time. And that makes a difference. Patients don't want to come and hang around and sit around and wait for 1 hour, 2 hours just to see a doctor.
Definitely.
They'll go elsewhere.
And the state-of-art equipment,
correct,
the ambience, all the care that they are receiving here in Al-Ahli.
The scanning machines we have, X-ray facilities we have nowadays. You can go in for an MRI scan.
On spot.
You're out, you go straight away and you're out within a few minutes. It doesn't take as long as it used to be, 1 hour. No, they're very fast scanners nowadays. And they give very accurate images and the radiologists to give us good reports. So that helps us to come to the diagnosis.
And speaking about trust, Dr. Stanley, the number of our guests who are choosing Al-Ahli Hospital is remarkable. It doesn't tell us only about numbers, but it also tells us about the confidence and the trust of the community in our services.
Correct. That's absolutely right. I mean, these numbers have stood up because we all know now we have so many health facilities in Qatar compared to 10 years ago. And so getting these number of patients coming through our doors every month tells us a lot, that even though we have other options for the patients, they still choose to come here. Even in the summer months when things are a bit quiet because most people have traveled, we still see a good number of patients. Oh, yes. So that is good for us.
And talking about the specialties, we provide all specialties that comes under the umbrella of orthopedic services.
Yes, that's right.
Such as spine surgery.
Spine surgery, neck surgery. So that's neck, lower back,
joint replacement,
shoulder, joint replacement, knee replacement, hip replacement, ACL surgery, fracture surgery, foot and ankle surgery, children's surgery for fractures, for all various conditions. So yes, we cover the whole spectrum.
Dr. Stanley, we have a special segment in Health Avenue podcast when we always talk about the myth and facts. I have some statements, and let's explore together what are the myths and what are the facts.
Yeah, sure.
The first statement is orthopedic surgery means a long waiting time and recovery.
No, that's a myth. There's no long waiting time. If somebody wanted to see us today, I've had some patients, somebody come speak to me, can they see you today? By all means, come along, we'll see you. If the patient is here, we'll see the patient. If not today, at the patient's convenience. So there is no long waiting time here. Long recovery is a myth. It really depends on a number of factors. Depends on the type of treatment done, how it was done, the patient, and the treating team. So if the treating team encourages the patients and monitors them carefully, they recover very quickly. There was a young boy I saw in clinic today. We did surgery on him 4 weeks ago, and just 2 weeks ago, this boy was just not walking. And I said, come back and see him in 2 weeks. With the help of physio, I'm sure you'll be fine. And today he's walking and he's very confident. So this is a myth. As you said, this long recovery time is a myth.
It's a myth. The second one is children can grow out most of the orthopedic issues and surgeries.
That is, in a way, it's a fact because not all, many conditions, children will grow out of them. So
because they're still in development
they're still growing,
phases
yes.
And growing.
But as clinicians and doctors, it's important to assess the children and make sure what they are presenting with, it's a condition that will get better by itself and they will grow out of it. Not just say every child has a condition that they will grow out, because sometimes there are problems they will not grow out of. So we have to assess them properly and be sure and then advise accordingly.
So we can consider it myth and fact.
We can consider it both ways. Yes, yes, both ways.
Okay.
Yeah.
The third statement is sports injury only happens for athletes and sports professionals.
No.
Actually,
to be fair, this is a myth. Sports injuries happens a lot more to people who are non-professionals.
Okay.
Because people are not professionals.
They're not moving, they're not exercising.
They're not moving, they don't have the appropriate gear, they don't warm up. And warming up for sports activities is becoming a very important thing nowadays. It's well known now that if you don't warm up adequately, you run the risk of injuries. So I can say for the level of sports that people do, sports athletes have less injuries than non-athletic people who want to do sports.
Dr. Stanley, before we wrap up, could you please tell us more about the future of Al-Ahli Hospital Orthopedic Center?
Yes, I believe the future, the center will continue to grow with the team we have and how we are progressing with imaging.
Space as well, Dr. Stanley.
Absolutely, yes. We are moving into a new clinic area, which is much bigger and state-of-the-art equipment. So we will continue to grow the service. And hopefully people continue to come to us because also word of mouth. People speak to others and tell them, go to Al-Ahli Hospital. We have a good team there who will treat you well. And we have better equipment there with hydrotherapy and physiotherapy just next door to us. So this is a good addition to the service and a good way forward for the service.
Dr. Stanley, I'm sure that you had many special moments with our guests. Could you please share with us one story that stands with you, perhaps a remarkable recovery of one child?
Okay. This is about one patient I treated a few months back.
Mm-hmm.
We treat many patients, but this is one that we always remember. You remember the good and the bad.
Yeah.
And this was a young man who came in his 20s, who came to see me because he was told to do so by a friend. As we know, there's a lot of word of mouth. Come and see Dr. Stanley, he will help you. And he came with what we call a locked ankle. Mm-hmm. So a locked ankle joint, what that means really in simple language is that his ankle, we all know when we move, our ankle joints move to allow us to get from one point to one point to walk. And he came with an ankle that was locked. So what that meant is that his ankle was not moving.
Mm-hmm.
And this happened after he was playing football and had an injury. And initially he thought, there's nothing wrong. I'll be fine. I just a bit of pain, twisted my ankle, give it a few days. And after 5 days, when he realized that he could not walk on his leg, he could not move his ankle, he realized there was something wrong. So he did an x-ray in another center where he was told there's nothing wrong. So he came to me. I saw him, I examined him. I realized his ankle was not moving, very swollen, bruised. I looked at the x-ray he had on his phone, because that's the only thing he had to show me. And I said, look, I can see what your problem is. Something is not right. So the x-ray showed that a piece of bone had come off in his ankle joint and was stuck in the joint.
Oh.
So because this was wedged in the joint, it didn't allow the joint to move.
The range of movement.
And he couldn't have carried on like this. And if we had left that piece of bone too, he would have developed arthritis in a few years' time, because it was part of the joint. So I explained everything to them. I said, look, I told them we needed to get some more investigation. So we did a CT scan just to confirm the size of this bone and exactly where it came from, because you couldn't tell from the x-ray exactly where it came from. And truly, it was from the joint in a vital area.
Mm-hmm.
So we then explained to them that this would require surgery. We took him to the operating theater for surgery, opened up his ankle joint, exposed it to see, and found where this piece, and truly there was a big piece of bone sitting wedged in the joint. So what we did, we took this piece of bone, fitted it back where it belonged to, and put a tiny screw to hold it back in place. And this boy has done remarkably well. He's back to normal. He's back to playing sports. His ankle is moving normally. So this is one that always sticks to my mind as one good success.
And I'm sure that there are many inspiring stories
yes.
that it will take us like hours to talk
go
about
through all
them,
this.
to go through them. That was truly inspiring, Dr. Stanley. Thank you for joining us and sharing all the great stories about Al-Ahli Hospital Orthopedic Center, from sports injuries to foot and ankle surgeries to the great expertise that we have, name it all. Thank you very much. And the most important thing is the trust of the community and our guests in our services. Thank you for being with us today.
Thank you for having me, and I'm so delighted to talk to you anytime.
Thank you.
All right. Thank you, and have a good afternoon.
To our listeners, remember, movement is life, and taking care of your joints, bones, and muscles is an investment in your future. If you or your loved ones need expert orthopedic care, you know where to go. Al-Ahli Hospital is there for you. I am Fadi, and this has been Health Avenue Podcast. Stay healthy, stay active, and see you next time.